Good afternoon, everyone, or good morning, depending on where you are in the country. I think we're going to give folks another minute or two to join, and then we will get started on today's topic, which is System of Care Finance and Sustainability Planning, Tools, Templates, and Strategies. As we're waiting, feel free to drop your name or location or which system of care you're calling in from in the chat. We'd love to see who all has joined us today. All right, well, I'm going to go ahead and start moving us through. My name is Suki Steckel, and I'm the Partnership for Transformation Team Lead with INTAC, the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health. And as I mentioned, today we'll be talking about System of Care Finance and Sustainability Planning, Tools, Templates, and Strategies. So just a quick disclaimer that this presentation was prepared by INTAC for folks in our network, and that the views expressed today by us or all of you as participants do not necessarily reflect the views of SAMHSA. And also, if for any reason we do not expect this, but if for any reason we have any issues with security, we will jump off and you all will receive instructions for joining another link via email. So just a quick overview about the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health. We have a number of partners, some of whom are represented here today from different organizations, and we really work in a multidisciplinary team to work to support the behavioral health workforce across the country. Our goal at INTAC is that all children, youth, and young adults and their families with emotional or behavioral health needs can access evidence-based treatment and recovery services in a well-coordinated system of care. And just a quick example of some of our cross-sector audiences are state and local agency leaders, like many of you that have joined us, the mental health workforce, like social workers and clinicians, primary care providers, folks engaged in the school system work, community-based providers, peer supervisors, and family partners, among others. And if you are new to INTAC, please know that our services are available to you at no cost. They come in the form of training, individualized technical assistance, and written products and resources. We also have podcasts. We have a wonderful 5 Things Digest series that come out regularly. We're available for individual consultation, and we have some fantastic communities of practice that I encourage all of you to investigate if you are not yet connected with those resources. Our partners, Amy and Joanne, will be posting information in the chat as we go along to help link you to those available resources. So I've introduced myself already, so I'll go ahead and pass it on to Jim Watring.
Good afternoon, everybody. It's a beautiful sunny day here in Michigan, and I hope you all are on vacation or not on vacation and dialed in. But anyway, welcome and thank you, Suki, for having us. I'm a finance consultant to the INTAC and formerly was the director of the National Training and Technical Assistance Center at Georgetown University, worked with states and communities all across the country, and have also been very active in national and state organizations. Before that, I was the director of programs for kids with serious emotional disturbance for the state of Michigan. And before that, I did a whole bunch of other things in community mental health and blah, 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 blah. So I won't take up any more time, Suki, but that quick overview.
Thank you, Jim. Pat?
Yes, good afternoon, everyone. Thanks for joining us. I'm Pat Hunt, the Executive Director of FREDLA, which is the Family-Run Executive Director Leadership Association. We're a national association of family organizations.
Thanks, Pat. Dr. Freeman Foster?
Good day, everyone. Dr. Freeman Foster. I am a change specialist at Change Matrix, and our goal is to provide technical assistance and capacity building to individuals and organizations who are striving to make a positive difference in the lives of their community, lives of the individuals in their communities. Thank you.
Thank you so much. And thank you to all of you who have joined us here today. I'm very excited to be kind of on this journey with you all, talking about system of care financing. And so our plan for today is we are going to introduce a new financial planning guidance document that NTAC is publishing as of today. So we will be posting information for how to access these documents on our website. We'll be posting those links in the chat so you have immediate access to them. We will also be sending links out in our follow-up information that is going to be sent out after this webinar. So the first thing that I wanted to say is to acknowledge that this is a really big topic, and 90 minutes is completely insufficient to cover the depth or even the breadth of this topic. So our plan for today is that we're going to introduce our new guidance document, and then we're going to talk about some key aspects of financial planning that we think are really important. We are also along the way going to share strategies for aligning our actions around financial planning with our system of care values. That is one of the things that we know is so important. And so that's really where we're going to spend the bulk of our time today. And then along the way, we are also going to review some key resources that are available to you related to this document, that the guidance document being published today. And so as we begin, please keep in mind that you are not doing this work alone. We are here to support you. You have a number of peers across the country who are also engaged in this work, and you really don't have to be, you don't have to be alone in this work. And so if you all hear something that resonates with you, go ahead and write it down. We will pause for questions, but just know all of your questions cannot possibly be answered today, but we do want to hear them, but they may be better suited for individualized consultation or a follow-up webinar. And so we'll be talking about some opportunities for that towards the end of our time together. So just know we're going to cover a lot of information in a short period of time, and we're going to kind of stop along the way. And also, this is an iterative process. So, we're going to start today, and then this is just the beginning of the conversation from NTAC's perspective in supporting system of care grantees in their very important work for figuring out how to sustain what it is that they want to sustain. And then lastly, when we're talking about aligning our actions with system of care values, we know that what those values are, whether you're new to system of care, you probably heard them before, or if you've been around a long time, you're well versed in these values. And so we wanted to acknowledge that we have some great partners on the panel today for our discussion, but we were unable to, we had a scheduling conflict with our partners at Youth Move. And so we do not have a youth partnership team member represented here today. And so we wanted to acknowledge that, and we are going to endeavor to speak to those issues as best we can. And we also challenge you all to speak to those issues as well as you're thinking about your own examples for how you're engaging youth and young adult voice in your financial planning. So let's go ahead without further ado and get started with our conversation. So when you think about financial planning for systems of care and sustainability planning, what is one word or phrase that comes to mind when you think about this? I know that I had some rather choice words when I was a system of care project director and principal investigator when I was thinking about this. So we would love to hear from you all. If you could go to menti.com and punch in the code that is there, that would be great. We'd love to see from all of you what your words are. We'll give folks a minute to do that. And I think Joanne is also posting that information in the chat. So I'm going to stop share for just a moment so we can see that. Joanne, do you have the Menti link you can pull up?
I believe Amy was going to.
Oh, I got it. Thank you. Okay, so we've got procurement, collaboration, heard that. Scary, yes. That was one of my choice words. Confusing, nightmares, absolutely. Complex, very. We kind of don't get away from that. Collaboration still holding strong. Challenging, yes, we're seeing that. Alignment with partners, that is absolutely key. Planning from the start, yes. You've heard it before, it's almost a trope at this point, but you have to start sustainability planning in year one. And as we're thinking about this, and you all are putting your words and phrases here, thank you for participating in this or dropping them in the chat. This is such, this work can be really complicated. It can be really complex. And so we're going to try to unpack some of that. But just know what we're going to present today is just one way of thinking about it. And also, if you're new, we really hope that this is an opportunity to learn some new things and think about things in a new way. And then if you have been or in the system of care arena for a while and you're kind of an old hat at this, thank you for joining. We really hope that we can kind of get back to basics with some of this information and also challenge you all to think about these topics in new ways. It's really important that we continue to learn and grow, as you all know, and which we're continuing to do every day. And I'm really excited to think about how can we really push ourselves to do better? How can we push ourselves to really investigate system of care values in our communities, and how are we realizing those through our policies and through how we're setting up and funding our structures that are supporting our systems of care. So it looks like thank you very much. It looks like one of the highlighted words there was, it looks like one of the highlighted words there, the most highlighted was confusing and challenging. So I certainly can agree with that. And so we'll try to hold space for that and recognize that, it's kind of one step at a time. So the new resource that is available, that we'll post a link to that resource in the chat, is the intact guidance for developing a system of care finance and sustainability plan. And there are 4 aspects to this new guidance document. And the first one, which we will essentially outline today, is the 7 elements of finance planning. Are there more elements? Of course. Is every single element going to be particularly relevant to your system? Maybe, maybe not, but we challenge you to think through all 7 elements that we're going to present today and that are included in the document. There are also considerations and potential strategies that we'll talk about for each of these 7 elements. The guidance document also includes links to relevant resources. So if you're really interested in a particular subject that we've talked about, whether it's equity or engaging family partners, we have endeavored to collect some information around that can kind of put it all in one place that can support your work. Also in line with linking to relevant resources inside this document, there's a lot of information over the last 10, 15, even 20 years that has come out from different TA centers, from SAMHSA, especially the guidance document that SAMHSA produced in 2018 that we know is really important. And so we have endeavored to capture all of that information and put links to that in this document as well. So we're hoping it can be a little bit of at least an introduction or a one-stop shop to start if you're new to this, that will help provide guidance and information resources that you can go and do a deeper dive in. And lastly, this document includes tools for engaging stakeholders and for completing a finance map, which some people, some communities consider optional. We definitely invite everyone to consider completing this, but we also know it's daunting and is one of the things that can be really challenging. So we've created a tool to try to take some of the guesswork out of that, and can't do the work for you, of course, but we've tried to set up some structures for you that can be helpful for you and your partners. So there are 2 key aspects that we like to think about when we're talking about finance and sustainability planning. And the first is the process, and the second is the product, which I'll talk about in a minute. And so when you're thinking about starting, okay, you just got the grant or you had a grant before and now you got a new grant. So you're kind of, you know, some things, but you're at it again and maybe you've expanded your population. The first major consideration we invite you to think about is the process by which you are going to plan. And the way that we would recommend doing this is to create a work group that can champion and guide your planning process. The reason that we invite you to think about a singular work group as opposed to perhaps maybe the main governance structure is that you might need to engage people that are not currently at your table to get further in this work. We also encourage you to gather stakeholder input via focus groups, surveys, discussions. If you need to drop into other people's governance meetings to ask some questions, go ahead and do that. It's kind of, we kind of take a no holds barred approach to this, where we really encourage you to think about who is going to be impacted by your plan and who has the power, influence, or authority to impact the implementation of your plan. So who is impacted? Your families, your young people, the children in your community, your providers, your funders, you know, and who has the power to impact, which includes your funders, but also those who are doing the work, your peer partners, your young adults who are serving as, you know, key kind of conduits for information in your community. Who are the people who are impacted? Those are the stakeholders. Those are the people who you want to gain input from about what you want to sustain and how you're going to sustain it. You also need to identify and obtain data sources and information needed to make informed decisions. This is an obvious one. We know, we've heard this before, but it can be a real barrier. And we encourage you to kind of keep on going when that happens. And also, because you're creating a plan, you can also include in your plan and acknowledge that, you know, we don't have this data. We know that we need it. And here are the steps we're going to take to make sure that we have it. And lastly, and really critically, is to complete a finance map, which we'll talk more about in a minute. So again, lack of information is not a barrier to moving forward. It can feel like a barrier, of course, we acknowledge that, but it doesn't have to be. You can continue to work with what you have. The second key aspect is the final product or the plan itself. And in your plan, the key things here are that you want to identify what your system of care wants to sustain. You can't figure out how to sustain it if you don't first know what you want to sustain. So these are different aspects of your service array, which we'll talk about in more detail. And it's also the structures by which you're going to implement these services. So provider networks, governance structures, how are you making decisions? Who are your funders? And then you're going to figure out how you can sustain it. And there are some new opportunities here for you all to think about, as well as the old classics, which we will, when we think about, you know, the child welfare system, the mental health system, the education system. So we'll talk through that today as well. And so lastly, when you're developing and finalizing your action plan, it's a kind of a plan like any other. You really want to figure out what those detailed strategies are for how you're going to sustain the pieces that you decided that you did want to sustain. And we encourage you here, and the guidance document goes into a little more detail about this, but for now, I'll just say that we encourage your plan and the language that you use to be actionable, to be realistic, and to use language that is accessible to all of your stakeholders. So we definitely encourage you to stay away from jargon, stay away from the use of too many acronyms unless you have a key that you can walk people through. But this plan should be understandable by a wide variety of people, not just a small insular group of folks who got together and kind of all speak that same language. You want to make it accessible to all of your partners. Obviously, as with any plan, you're going to include a timeline and responsible people and entities. That's a little bit of the kind of classic plan format that you might expect. And lastly, your plan should not be collecting dust on a shelf. It should be a dynamic tool that is used and reviewed. We recommend every 1 to 2 years. So this is something that you all should be revisiting on a regular basis. You should be adding more information to it as it comes available. You should be widening your partnership and your stakeholder groups that are engaging in this process. Okay, so now we're going to jump into the 7 elements, and we're going to go through just a brief overview of each of the elements, and we're going to talk about some suggested strategies around this and examples. And we invite you all, as we're talking, to drop some examples that you may have from your communities in the chat, and I'll pause after each element to see if there's any questions from the audience. So Jim, I'll turn it over to you. Oh, Jim, you're on mute.
Okay, I'm back. Thank you, Suki. Been a pleasure working with you on this project, and it's taken a fair amount of time for both of us. But I want to thank all of you for your input too, because this is a complicated issue. It's scary. None of us went to graduate school to learn about financing, especially in any one system. And many people built a career just understanding Medicaid. So all of these systems coming together is no easy task. And I remember when I had my first system of care grant at the state in Michigan, and I saw the finance plan as job security. So you may want to begin to think about it that way. But so closely tied to the population of focus is the various funding systems. And you're going to have relationships with child welfare or juvenile justice that may be strong. You may have a great relationship with education, and you may have a hard time with the adult mental health system or substance use. So as you put your plan together, it's going to be based on a lot of relationships, as Suki said, and working through those relationships and joining with people to identify the various fund sources as you get into this. So scanning, trying to understand your population of focus, because eligibility criteria is very closely associated with finance. You can't separate the two of those things. So the scan is really a beginning of looking at, okay, we got our partners at the table. What kind of funding are we using? What aren't we using? And some partners are not going to be able to get the data. Some partners are not going to want to give you the data, but you're going to have to begin to build those relationships and begin to work together. And I think that can be done. A map, and we're going to go to the various fund sources. Thank you, Suki, for moving me along here. I got to unmute myself. It says sign came up here. I don't know what that is, but there it goes. So there's various fund sources that you can use. The Medicaid one is the one everybody says they're going to use when they write a grant, or 60%, I think, came out in our survey. They're going to expand it somehow or another. Well, if you're going to do that, you're going to have a very good relationship with your state office of Medicaid, because it is a state single agency. You're going to have to be involved with your mental health system more than not. If it's local, it may be related to a managed care organization. So Medicaid is a big choice that people use, but child welfare has a lot of opportunities in it as well, and not to negate that. And for example, Families First is a big initiative going around the country. So I would begin to take a look at that. So basically, we're moving on now to, I did add one more thing I want to mention. The mental health block grant, the American Rescue Plan, has a $3 billion increase. Suki, I got to mention it. I just was researching it today. And for some states, so for example, Missouri, that's $24 million. For Michigan, $41 million. Substance use block grant, $21 million for Missouri, $45 million from this. So it's just an example of this block grant that's there that I would encourage everybody to take a look at. That's news hot off the press from me anyway. It's been out for a while. You're going to have to work with your state to do that. Okay, I just had to highlight that one.
Yeah, that's great. Thank you, Jim. No, I just wanted to introduce folks just quickly as we think about actually mapping this information. Part of the new guidance document that came out, one of the tools that we've created for you all is a map. As you can see, it's in Excel file, which means that there are formulas that are in here that we've included where you can, add and change and, add lines and rows. And so we've just essentially tried to create a tool for you that will help ease your planning, and the funding categories up here on this top row in gray mirror the funding categories over here that are, come out of SAMHSA's Finance and Sustainability Plan template information. And then we've got some references to the recommended array of services. I'm getting the pinwheel. Oh yeah, so we have some recommended array of services that we'll talk about more in a little bit. So that's just one of the tools that we have available to you. So I will pass it over to, sorry.
Tanisha.
Tanisha, yes. Sorry. Sorry.
Thank you. No worries. Thank you all so much for going over these things. And I think one of the things that Jim said was key is that it's about relationships. And so I know when I first started to look at this document, when I was doing this work directly, this step one was the most overwhelming step. Like, where am I going to get this information from? Who's going to talk to me about this? And so the key is to start where you are. Start with your own organization. Look at how the spending is within that organization, and look at the partnerships that you have and find out the information from those organizations. Also, the internet a lot of times is your friend. You can find a lot of information from the internet. A lot of organizations publish their business meetings and their documents online. And so you may be able to find that at a state or local level for your area. And then look at it as a tree. Start with the lowest fruit at the bottom of the tree and work your way up. And you can have a waiting room or a parking lot of people that you would like to touch bases with and that you would like to obtain this information from, but really focus on the successes. These are the people that I've been able to obtain this information from, and these are the people that I'm still working on. And you may find some cross collaborations going on with the people that you do know. They may be able to provide a warm handoff or a warm linkage to somebody else that's on your list. But I think really the key component of this is to be able to see those small successes in front of you and to be able to say, okay, these are the people that I've been able to get this information from, and these are the individuals that I am working to get that from. And it may not happen this week, it may not happen next month, it may not happen next year, but it's still on your radar and it's still on your list, because otherwise this process can become really overwhelming and something that you just feel defeated and end up putting down. So really just celebrate the small successes and do it one step at a time. And it may be a random meeting or a conference that you see someone from one of those organizations that you can touch bases with and form a relationship with and be able to get that information. So really be intentional and mindful that this doesn't happen overnight.
Thank you so much, Dr. Freeman Foster. I think that's really, really good advice. I remember it was completely overwhelming to me when I was doing this work at the state level in Tennessee. So I really appreciate that. Okay, so we're going to move on to the second of 7 elements, which is realignment of funding streams and structures. And I'll pass it back to Jim.
Thanks, Suki. Yeah, so there's going to be a lot of different fund sources that you're going to be playing with, or hopefully playing with, and being able to use for different things. I generally call it braiding funds. It's hard to blend funds because they're tied to appropriations and other issues. I've mentioned the mental health block grant already, so go online, you can Google that, and that might be a great source for folks locally as well as at a state level. It will have to be tied into a state mental health plan. But now's the time. I think it was in May that this was announced that I was looking at today. Flexible funds is very hard to get to sometimes, but I would encourage you to use local money sometimes for that, because you can get grant funding or funds that aren't so tied up related to eligibility criteria. Eligibility criteria is really the state issues. You got to be on Medicaid, or you got to be involved with child welfare. You got to be involved with juvenile justice. Flexible funds can be done with Medicaid as well. A little harder to do, but it can be done, and working with your managed care organization for that. I've mentioned the Families First piece, and I would encourage you to partner up with your child welfare agency. It's really a nice opportunity. They're going to need your help because it's a huge lift for them to be able to keep kids out of residential and keep them in the community. And they're going to need specialty mental health services in order to do that. And then finally, the certified behavioral health, community health, certified behavioral community health centers are federal funding that is available in a number of states now. And I'd encourage you, where you can, partner up with them because they are looking to develop basically systems of care in the community. It does involve adult services as well as youth services. And sometimes it's more focused on just adults and not so much on youth. So I'd encourage you to look into that. So I'm going to turn it over to Pat. Suki won't have to interrupt me this time. I'm cutting it short.
Thank you, Jim, so much. Sustainability really begins and ends with youth and their families. They are the one constant in your system. People change roles, new teachers. As children get older, they have new teachers. There are new agencies, new providers. They move from pediatricians to primary care providers, from living at home to being on their own. Social and political issues change. So if sustainability is not part of the plan on day one, we remind you the clock is ticking. So moving from principle to performance will help you market the why of sustainability. Positive outcomes help you demonstrate that you're good stewards of public resources and that you can serve more people more appropriately. So one example of the realignment has happened a few years ago in Arizona. This is an MCO example driven by the concerns of families regarding out-of-state and out-of-home placement practices that were occurring there. They began with key concepts for all providers around community-based, out-of-home, and family-run organizations. The concepts included family involvement, community involvement, service integration, targeted discharge planning, and provider integration. They developed a 10-month strategic timeline using a Maricopa County application of a white paper that was developed in 2008 regarding community-based and residential care. They identified system-wide functional issues and outcomes, such as lives with families, success in school, avoiding delinquency, increased stability, decreased safety risk, and stable productive transition to adulthood. In addition to the system-wide functional outcomes, they also focused on targeted metrics such as monthly census and bed day utilization, average length of stay, admissions and discharges, cost of care, out-of-home risk, out-of-home diversion. You guys get this, you know what I'm talking about. They strengthened the child and family team treatment model, both the operational processes and the use of guiding tools. And they instituted a joint provider rollout by level of out-of-home care. They also instituted monthly joint provider planning and strategy meetings. When I say joint provider, that's residential provider, out-of-home provider, and other community-based care providers, all the while strengthening their community-based options and processes. The outcomes, there was a significant drop in out-of-state placement between April and January as they used the CANs and other tools and information to strategically plan for each individual child and youth to return home to Arizona. That doesn't mean necessarily to their homes, but they were getting care in Arizona. The residential bed utilization dropped over 57% in 8 months. The functional outcomes increased between 60 and 80% during the same time frame. And the residential census reduced by 60% in 22 months. They strengthen the front end in service and back end approach by incorporating families throughout the entire process, both on the front end and back end of the decision making. So in other words, more young people were receiving the care that they really needed, leaving the residential resources for the kids who needed it the most. So back to you, Jim.
Thank you, Pat. That was a great
Thanks, Pat.
example.
Moving on, Suki, go on, move.
Yeah, yeah, we'll move us along. Sorry, my mouse is very sensitive. So we've just talked about a couple of different examples and different angles, and I wanted to pause just for a moment to see if there's any questions from any of our participants or examples that of realignment and funding streams and structures that you all would like to share.
Someone put in the chat and said, I would like to learn about states using Medicaid for flexible funding. In Colorado, I heard it's not possible, but maybe it is.
I know a little bit how it works in my state, but I live in Arizona, but I'm not the funding expert on this call. So if Christine would like a follow-up conversation, that would be it. It depends on your state because there's a lot of state laws. So Christine, if you live in Colorado, that may or may not be true. So we would have to dig into your state laws of Colorado. I know it is possible in Arizona, but because of our underfunding of education systems, it makes it hard to implement because schools would have to purchase someone who can process insurance billing. When you don't have enough money for teachers, it's hard to justify someone who can process Medicaid billing.
That makes sense, and I appreciate your feedback. Yeah, I'd love to be able to talk. In Colorado, we're doing just our past legislative session, behavioral health reform, finally. So I'm really excited, and we have some, we have 94 million in our supplemental block grant that is coming into the state, as well as our Behavioral Health Recovery Act. So we're seeing dollars are definitely not the problem at this time, which is unusual. And so taking advantage of these multiple opportunities for reform, and I just like to hear if other states are doing that to see, and I think our state Medicaid has some appetite potentially for that. So.
Well, and I think one of the things to think about strategically when you're talking about flexible funds is to frame the conversation. And I would say I would put this in the box of data that's needed or evaluation information that you might have, where flexible funds increase a family or an individual child's ability to meet their clinical goals or the terms of their clinical treatment plan. And so when you can tie those flex funds to the clinical level outcomes, that's when I would think a mental health funder or a Medicaid funder would be really interested in that. And especially if you had individual or kind of local level evaluations where you could see where the use of flex funds actually improved outcomes versus maybe a control group where families didn't have access to flex funds and had not as robust outcomes. So that may be a really important part of the conversation if you're looking to advocate for a payor to use or to integrate flex funds, for example, into your Medicaid plan. It would have to be tied to your providers and those contracts. And so thinking about how are those administered, but really the relationship is about, what's the rationale for the flex funds? And it kind of goes back to supporting families in a way that families can drive and that young people can drive because they're really driving their own treatment plans. Okay.
I would add that there's one thing, Suki, and that is when you get into these financing discussions with your partners in child welfare or juvenile justice or Medicaid in particular, there's what I call finance boogeymen. And people over the years, they've made up different rules, whether they're real or not, or whether they're grounded in law or not. You're going to have to dig pretty deep sometimes to figure that out and to see what is the rule in law that's prohibiting that. So sometimes people come up with these things And I used to have it in Michigan when I was there, and I'd call it, we got to chase away these boogeymen. And there are ways around many of the rules. It's easier to do in managed care than it is in a fee-for-service system. So there's lots of strategy, but it's a lot of work too sometimes to get to the root of what that rule or law may be.
That's a really good point. Sometimes we keep on, administering a policy that may, or interpreting a policy in a certain way that may not actually be accurate. We've just been doing the same thing for so long. We haven't taken a moment to look at it. So it's a really good point. All right, Jim, I'll pass it back to you to talk about financing appropriate services and supports.
Sure. I'm going to leave the first part for Tanisha to come back to. But flexible funds we just talked about that, so I'm not going to go through that a lot. Incentives are really important, and they can be done in a lot of different ways. You can, increase a rate for evidence-based practices based on the training and the technical assistance and the cost of that particular service. And you can build that into a Medicaid rate or into a child welfare contract, because that is going to be important in order to provide all of that additional training. And that's been done across the country in a lot of different states. But again, it can be done at a managed care organization level. They can provide that incentive, or it can be done at a state level if it's a fee-for-service system or some other way you want to organize that. EPSDT is a common tool that scares Medicaid offices to death. And it's called Early Periodic Screening, Diagnosis, and Treatment. And it basically states that you must provide the care that's identified in a screen for any child based on Medicaid rule and law. Now, that doesn't mean that's going to happen overnight. There's been a number of EPSDT lawsuits all across the country, and it's because they didn't follow that rule and law. So it's a special provision for children. And sometimes it works and sometimes it doesn't work. Sometimes you end up in court for 5 years and it doesn't go anywhere. However, it is in the rule and law. So I would encourage you to explore that, and there's a lot of literature on EPSDT. There's all kinds of different ways to support wraparound or care management, and that can be done with targeted case management. That can be done with child welfare services, juvenile justice. I mean, there's a whole bunch of ways to pay for that, and I would encourage more individualized care. We call it care management now, or wraparound, individualized care when you're doing that with a very small caseload. Because if you're working with really seriously emotionally disturbed children, they're going to need a lot of service and support. So I'm going to stop, and Tanisha will let you come back to the culturally appropriate services and supports, because that gets at individualized care, really.
Absolutely. Thank you so much, Jim. And I know we spoke about this earlier about the importance of youth and young adult and family voice. And this is one of the areas where it especially is important. And it's important throughout all of the elements. I'll say that first. And this is an area where it's especially important, because sometimes as service providers, we have our specific network, we have our specific partnerships and collaborations. But I think it's important in this element to make sure that we have a panel, or that we have a focus group of people who will be receiving these services, to say, this is what I need, and this is where I'm already receiving it from. Because a lot of times they know what those resources are in their communities, and they can help guide and lead us. Otherwise, we end up taking programs and building them and then turning around and trying to put people in programs that have already been built. And we know not only is that ineffective, a lot of times it creates collateral damage. It creates further oppression and marginalization of diverse populations and communities. And so we have to be really careful about this. Not only is it about financing, but it's about helping individuals be their best selves and helping communities be inspired and do the best for the individuals who live there. And so it's important also, we put evidence-based and promising practices. That's another key. And what I've always done and recommended is that find out what works. Talk to the individuals who are and will be receiving the services and find out what works, and then build backwards to figure out what type of program and what type of practices we have versus trying to focus on evidence-based material, because we find a lot of times that evidence-based material has been created several years ago and it may not have even been tested with your particular population. But if you're able to do what works and take those core elements from those practices and say, okay, this is what we're doing, this is how we do it best, and then try to take it and categorize it on the front end. Again, always putting the children, youth, young adults, and family members first, and doing the other work on the back end instead of the other way around.
Thank you, Dr. Freeman Foster. I think that's a really good place to pause and invite our participants to see if there's any comments or questions. Feel free to unmute yourself or we'll drop in the chat. Anything you'd like to share around that? I know many communities have kind of struggled with this evidence-based versus promising practices issue, and there's definitely been a lot of state and federal level initiatives promoting evidence-based practices. And sometimes when we get overly focused on that, we may stop, or we may kind of fail to investigate whether or not these are the practices that the communities that we're serving actually need. You know, maybe there's something that's already there, as Dr. Freeman Foster shared. Okay.
Yeah, just to chime in on that point, it's just such perfect timing. As in Colorado, we just reestablished our Youth Move statewide chapter, and really organizing young people around, one, we have lots of opportunities with the various legislation around behavioral health. And so we have done a bit of mapping and had a great opportunity to be a part of the Youth Move peer learning group earlier this year, which really helped us utilize the YVAL tool to engage in a continuous quality improvement. And so taking that work that we did for the past 5 months and bringing it up through, you know, I'm a program manager, up through the layers of leadership within the state office of behavioral health where I work. And so we have a lot of support. We had some great meetings with leaders today and have a presentation next week with our communications director. And so we've done a lot of work in the youth realm, and my next target is really developing more of a solid network for family members on that kind of broader umbrella of all that fall under that, to really help shift culture in Colorado, also with the great timing of behavioral health reform, to really be innovative and actually reform. I worry that we'll just kind of do something very similar and just put another brand state agency office title to it, but really nothing, the experience of children, youth, and their families not really changing. And accessibility, especially in the rural communities, which is the majority of our state, you know, continue to struggle, and we have poor outcomes. So thanks for making that point. And yeah, it feels like a bit of an uphill battle, because that's not the culture we design for families without bringing that voice. And so, yes, I'm on a mission, but we'll see.
Yeah, well, we're excited to be on this mission with you, Christine. I think that's a really great example, and it's kind of a perfect segue to element 4 as well, which is about financing to support family and young adult partnerships. So you kind of tag team, I think, both sections here. And I think you've also, your comment also reminded me that, you know, we think about systems, you know, even just the name system of care. It's like, what even really is that? And I was in conversation yesterday where we were just talking about that, and it's like systems are people. You know, systems are made up of people, and sometimes we forget that. We put everything in this box, or say, you know, that system over there is not acting right, or that system over there, you know, needs to be, you know, supporting us more. And it all does truly boil down to relationships oftentimes. And so I think you highlighted in your example that, you know, when you said like, we hope that they don't, just kind of stick another label on that. And it's really like the they is us, right? Where are we advocating for that? Where are we building those relationships that we can even open the door to conversations around partnerships with family members and young adults? And so I think when I think about financing for family and young adult partnerships, that last word is key. It's partnerships. It's all about partnerships. And oftentimes in our systems, especially in our mental health systems, we think about young adults or youth and families or children as the recipients of services or clients or patients. And we don't always think about them as partners. And that's really the paradigm shift that I know the system of care movement has been working on for decades and decades at this point. And so I think highlighting this idea of partnerships is critical, because this is where you kind of, this is where the rubber hits the road, is how are you funding those partnerships? And so when you're talking about, one of the strategies for living into your values and kind of moving from a principle to a practice, or even in, thinking about the system of care value of family driven or youth driven as a value, it's really a verb. So what is the action behind that? And so that means that there's money there. That means that you have a policy that supports that. That means that you have an administrative structure that supports that, which sometimes, requires money. So thinking about establishing or funding a new or support an existing, that's really key too, is like not coming in and creating something new if there's already something that's working in the community, even if they don't know the word system of care. What is the core work of what they're doing? And maybe that's what needs to be supported, because they're already there and connected to the folks that you're trying to reach. So thinking about funding family and youth organizations. Also, how are you funding orientation and training and education for leadership development? If you want to partner with young adults and family members on your governance structures, how are you preparing them for those roles? How are you preparing folks to be peer support partners, whether they're young adults or family members? How are you setting your contract standards? How are you incentivizing your providers to have family and youth to be family and youth competent, and to really engage in partnership with family and youth? And do you have you funded a local, state, or tribal level youth coordinator or family partner at that level who can help with things like language and policy development? So I'm going to turn it over to Pat to see if what strategies she would suggest for us in this area.
Thank you, Suki. So I think history.
Oh gosh, I'm so sorry. I accidentally muted Pat. I think, Pat, you have to unmute yourself. I accidentally hit that when I was trying to mute myself. I apologize.
That was tricky. Good, thank you. I think history's taught us a few lessons in this department, whether you're a provider or a care management entity, a state agency, and the employee peers. The challenges for both the agency and the peer can seem or can actually be insurmountable if you're not prepared. Everything from the culture of the organization to the bias and life experiences of the current employees, to the priorities of legislators and shareholders, all come into play. So a few examples that promote success is employing family-run organizations to review and develop your agency readiness to employ, supervise, and retain peer staff, to review and revise workflows and your protocols and agency practices to really fully embrace family voice and experience, to ensure that your existing employees are prepared to embrace families as members of the team, full members of the team, that they understand one another's role and contributions and the return on investment that accompanies the parent-peer role. To fund the family organizations for training, co-supervision, and support for the peer workforce. To connect the workforce to national opportunities for continuing best practice. One example of that is Fredla's peer support community of practice and the communities of practice that are available through INTAC. Don't stop at peer support. I encourage you to build opportunities for upward mobility within your agency. Are you going to spend resources hiring the best families you can hire, training them, supporting them, supervising them, really being partners in this work, and then they're going to go work somewhere else if there's no upward mobility. So they can play a role in hiring, they can be part of care management teams, serve in CQI functions, assist with network development, they can perform assessments. If you employ families, they must be part of your management infrastructure. So thank you, Suki.
Thank you, Pat. Are there any examples from participants around partnering with youth and families or engaging in youth and family voice that feel particularly relevant?
Suki, I have one at the policy level. I probably should have shared with you if you want that.
Sure, of
Are
course.
other people weighing in? Well, partnerships.
There's nothing in the chat right now.
Okay.
Go ahead, Pat.
Partnerships at the policy level yielded landmark legislation regarding serving children, youth, and families in Maine several years ago. And that legislation included a legislative oversight committee that was actually in function for several years, which included family members who were appointed by the president of the Senate. And the legislation really outlined the funding that would be used, how services would be determined, which was very similar to a wraparound process, and increase the type and capacity of services for children and youth. So that's one example of a partnership at the policy level. In a meeting yesterday, the policy level seems to be a really complex area for people to be able to recruit families right now. So we're doing some work with folks around that.
Yeah, that's really important. Their voice, I mean, they're the experts. They are the experts in the type of care. And as Dr. Freeman Foster said a minute ago about what can help people be their best selves, they're the folks who can tell us that. And so finding those opportunities so that they're meaningfully engaged at every level of a system of care is really, really critical. Okay, so we're going to jump to element 5. We are getting close to completion of all of our 7 elements we recommend that you all consider when you're thinking about your finance plan. And this one is really, they're all important. This one is really critically important. Not only do we think about cultural competence as a core value in systems of care, but for me, the key thing right here that we want to make sure that we challenge you all is to really widen your lens about how you're thinking about culturally relevant services, and especially around working to reduce disproportionality in care, which we know is an issue pretty much in every area. And so when you're thinking about how are you funding this, there are some key pieces that we encourage you to think about. And one of them is exploring funding sources to pay for culturally specific specialized services, things like non-traditional services that may not be ordinarily covered, like under a Medicaid plan, for example, the use of indigenous providers and natural helpers. Really, when you think about I'll just kind of use a wraparound example for a second, but when you think about who would you want on that wraparound team, it is usually not the person who might be funded to be there typically. This is where flex funds sometimes can be helpful. This is where just expanding your view of the supports that are needed to support a family, and also to go back to the community and understand who's already there doing the work, and inviting them to your system of care table so that they can help you answer some of these questions and say, you know what, this is what's working for our families, and this is, and having some additional support from these larger systems can be helpful for that, but we're doing it anyway. So engaging in those community partners can engaging with those community partners can be really helpful. Also, we kind of have used this word a lot today, incentivize, also offering fiscal incentives for providing culturally relevant, equitable, and anti-racist services. If you're not incentivizing it, people probably aren't doing it, especially in the way that a lot of contracts are set up around kind of performance-based contracting and things like that. Incentives are critical. Providers look at incentives. So this is a great opportunity for looking at an administrative structure or a funding structure for incentivizing this work. You can also set, your system can set contract standards for having providers who represent the cultures of the service population. So who is being served, and are they represented at the provider level, not just a service recipient level? And so that could look like, just for an example, requiring managed care organizations to include a certain proportion of diverse providers in their network. We know that sometimes people are not coming back to services. So you have that attrition in services because the people are not connecting with their providers. And so if you can expand your provider network, you can reach more people. It's kind of a relatively simple equation, even though it can be complicated to do and to figure out. So fund outreach activities to culturally and linguistically diverse populations. So how are you even getting there? I have seen in some of my visits around the country with folks over the last many years, so many excellent examples of this, from engaging in just local newspapers, radio ads, like where is the community getting information? And that's where you go. That's where you start having these conversations and working with folks who are at that level. And also funding a cultural competence coordinator at the state, local, or tribal levels, like someone who can speak to this, but of course is not solely responsible for this work. So those are just a couple of things to think about. I'll pass it over to Dr. Freeman Foster to give us more examples.
Thank you. So this, I think, one of the critical components of this is self-reflection of us as funders and us as providers as well. Because a lot of times what happens is that we try to implement criteria or contract standards that we within our own organizations are not even following. So I think it's important to model the way as you're looking for providers who are culturally responsive and reflect the diversity in your community. That also has to be taking place within your organization. You should be modeling the way for the things and the things that you would like to see in your community. And so one of the key things here also is that youth, young adult, and family voice. I, as a provider, cannot say that my services are anti-racist, but the individuals who are coming in and receiving those services, they are the first experts of if these services are anti-racist or not, and they can tell me who's doing it well and who's not doing it well. And so within this, creating opportunities intentionally to be able to receive consistent feedback from those individuals who are receiving services around how can services be improved, and listening. That's the other key, listening, not just saying we want to hear from you, but listening and doing something about it. And talking to individuals in the community what things have changed, because we know that people change and programs need to change at the same time in order to meet the needs. And so really looking at this from that lens, that this is something that's fluid, that things that people needed last year, they may not need this year. And we may need to go back to the drawing board and say, okay, we've served this, and now this is the gap. Things have moved over this way. Who can we find from the community that are doing these things? One of the things that comes up frequently that I found is that a lot of times when you look at individuals who may not be doing this work all the time or doing it in the way that traditional systems do, we, instead of calling it non-traditional, we call them innovative wellness providers, because non-traditional a lot of times implies that you're doing it wrong or you're not doing it like this group over here. And so in an effort to create equity, we're saying innovative wellness providers. And so sometimes with your innovative wellness providers, they're your smaller organizations, and they may not have the capacity to fulfill all the contract standards and all of the systems and the processes that are required with a lot of these large grants. And so it will require time. It will require ongoing meetings with them to try to help them establish those processes, or providing them with additional funding, or funding a provider and having someone from that other organization come in once a week to provide them with information or with processes to help them navigate this. And so that's one thing we have to keep in mind. I think sometimes we know who provides the service in the community, but because they don't have the capacity to provide it to that standard that's required by a lot of times federal funding, they're overlooked. And so if we look at them from another lens and say, this is what our clients need, this is what our healthcare participants need, and how do we bring them on? How do we support them in their contracts department or in their human resources department? And so that's one of the things that we have done in the past, is find an organization who is familiar with these processes and find an organization who may not be as familiar with this process, and have that organization or have a contract with them, subcontract with them, and bring them under their wing as a mentor and say, okay, these are the systems and this is what we'll do. Instead of you ordering the office supplies, you will let us know once a month what office supplies you need. We'll put it in with our organization's order. It'll reduce the cost and we'll send you the stuff on the 10th of every month. And so things like that, to be creative. We have a system where our organization is able to provide time off for young people, and we're able to fund them with benefits because we have a larger group of staff who are receiving benefits versus your organization where individuals are contract employees, and we want our families and young people to be able to have benefits and be able to take care of their health. And so we will take them under our wing as our employees, and they will be co-employees. And so those are some of the innovative things that we've done, but I want to make sure that we know that it's about capacity building, and it's about really spending time in trying to help these organizations thrive so they can provide culturally relevant services.
Thank you so much for that. I think you bring up a couple of examples I just wanted to highlight that was kind of percolating through my brain is the capacity building piece. Is when you think about systems of care or a system of care, and you read words like you get a with your grant you get a certain percent towards infrastructure, helping organizations with their capacity to serve your community is an infrastructure activity. So I mean, it's like these things are connected. They're not you may be using new phrases. I love the innovative wellness provider. You may be thinking about this in a new way, but there is a piece of the system that is set up to do that. It's just, how are we thinking about it, and how are we challenging ourselves to think about it? And I really appreciate that example. The other part of what you just said I wanted to highlight is that when we think about, sometimes we get in, even when we think about our values, like our system of care values, culturally competent, family driven, youth driven, we almost can tend to silo those activities. Well, we've got a youth coordinator, we've got a family partner, we've got a cultural competency coordinator. And you've illustrated and really well, I think, the point that you can't be working towards culturally relevant services or practices without youth and family partnership. Youth and family voice is how it's one of the main avenues by which you achieve your journey towards or journey on cultural competence. And so these things are connected. So we talk about this as a separate element. So I wanted to encourage us to think about elements 4 and 5 are really connected. That youth and family voice is totally connected to our ability to respond in a culturally relevant, culturally appropriate manner. So I'm going to pause there. Are there any questions in the chat or any comments from our participants around this element?
No questions in the chat.
Okay, thank you. Okay, so we've talked about family voice, we've talked about culturally appropriate services. So element 6 is thinking about financing to improve the workforce and our provider network for behavioral health services. So this is kind of taking a step back, saying, who is providing your services and what are you doing to help support their capacity building, as Dr. Freeman Foster just mentioned. So this part is really, really key. If we have any hope of working towards becoming more anti-racist, to working to address disproportionality, working to address issues of equity, there's a lot of that self-reflection that is needed. There's also concrete issues around the shortage that we have in our workforce issues, that's a big issue. I know many states are struggling with, many communities are struggling with recruitment and retention activities, thinking about turnover, why people are leaving, thinking about how your organization addresses equity. Those two things probably go hand in hand, at least to a certain degree. So investigating that is going to be really important. So element 6 sort of follows element 5 for a reason. So thinking about, workforce development writ large, yes, you want to be looking at recruitment. That goes up and down the chain, and you can even find some innovative ideas for things like this when you're recruiting your behavioral health workforce. I encourage everyone to seek out their Medicaid offices, their behavioral health partners, behavioral health authorities, or departments of mental health and substance abuse, and see what are they doing to address this issue and how can you help. If you're a provider, is your voice being heard around these issues? Making sure that your funders know what the current issues are can be a major tool for helping potentially to increase funding or to maybe have other folks pay for your training, for example. So if you know that you have kind of pre and in-service training or coaching that needs to happen in your organization, what are your behavioral health partners at the state level or the county level doing to support that? And can they support it? Can you partner with other agencies to join in? So you're doing, everybody's getting trained at the same time. So there's definitely a lot of opportunities for innovation in this area, and just simply that it needs to be addressed in your plan. I mean, that's like, this is, we tend to think about braiding funding or different funding structures and things like this, but this is critical. Having your workforce expansion and development integrated into your plan is critical. There's lots of different ways to do that, but simply making sure you address it is the very first step. You can offer financial incentives to attract providers to underserved geographic locations. This kind of goes back to that workforce shortage issues. You also can work with partners, private or public partners that might be willing to do things like provide scholarships or student loan forgiveness for certain population or certain providers especially in shortage areas. So there's a lot of innovation I think that people are interested in having right now. I think the pandemic has showed us a lot about the importance of having a well-trained and well-supported behavioral health workforce. So this one is really key. And we need to get paid, right? So as providers, you need to have payment rates that are sustainable and that are going to, do more than just keep the lights on at an agency. So thinking about, encouraging the provision of EBPs and promising practices, allow providers to participate in team meetings. I mean, that sounds really basic, but sometimes that's actually a barrier. So we aren't even really hearing from a system and policy level what's going on at the provider level. So being open, I mean, part of the system of care is as a system representative, we need to be making that table longer. We need to be keeping the doors open. We need to be having those bidirectional conversations so we can make informed decisions. Definitely supporting work with young people and their families, obviously coordinating services with other agencies, kind of some of those multi-pronged, training opportunities for multiple agencies that they can participate on. Oftentimes the state agencies can fund peer support training, for example. It doesn't always have to be people funding their own training or professional development. State agencies can fund that too. Block grant dollars are a great example for that. Allow providers to serve individuals and families at home, at school, and in the community. Going back to culturally relevant or appropriate services, asking people where they need to receive services is really, really critical, just as much as asking about the quality of those services. So figuring out how, how to make it possible to have different service settings, which depending on credentialing and licensing issues, this can really be a barrier. So investigating that, hearing youth and family voice on this is important. So I will pause there and pass this over to Pat.
Thank you so much, Suki. Hopefully I'm not too repetitious. I think my examples I'm going to talk about sort of tie the last 2 or 3 items together with an example. So number 1, hire from within the community you serve to the best of your ability. and if not, definitely reflect the community that you serve. Developing incentives, reward for quality, value-based purchasing, or whatever you call it, where you are, tying the money to outcomes. I would go as far as saying, tie promotions of staff to performance as measured by youth and families who are served, as well as agency criteria. I think that's really how shining the light on success, on people who are doing a great job of doing things the right way is really important in raising that bar of expectations a little. An example of this element is a large county that was building a provider network around the value of cultural competence. And they undertook that task by conducting a thorough demographic study, conducting focus groups of families and youth, both who were receiving and those who would be eligible to receive services, but they weren't receiving them because they had not come forth, or they had not done the outreach, or they didn't realize or they didn't trust perhaps who was providing the services. And they did that outreach to learn about their cultural, linguistic, and service needs. They applied an approach that was totally principle driven and kept their focus on meaningful outcomes with advancing resiliency and recovery. And they used multiple tools and resources to determine the service needs. So they used geomapping to provide them with evidence of where individuals resided relative to where the services were located, and saw a huge gap. And through ongoing feedback from providers, staff, stakeholders, I'm making this a shorter story than it really was, throughout the community, they identified emerging trends, which were used to identify programmatic, geographic, and linguistic program needs. So this dynamic feedback was translated into training, into program and outreach enhancements, and into recruitment of staff that and providers that would be more appropriate for the community. They engage cultural brokers and promotoras and widely distributed materials written in Spanish that outline such things as developmental stages of infants, children, and youth, with encouragement to share any concerns that parents may have about their child's development, where they felt safe to share it. And that would be with the promotoras and other people from the community who made them feel safe. And then they became part of the larger provider network. So this yielded more concentration of appropriate providers in the area, greater enrollment in the necessary services, and earlier intervention for those children and youth who may not have received services at all if no one had undertaken this task. So thank you. I hope I'm within the time.
Yeah, thank you, Pat. It's all good. We're going to get through it. We're going to get through. I know we said we would cover a lot of information. So the very last element, and this is certainly last but not least, is financing for accountability. And I think in many ways we've touched on this as we've talked about things like incentivizing providers, incentivizing certain aspects of different contracts. And this one is, I know sometimes in my experience implementing systems of care with different providers and looking at that, we think about evaluation. And this is sort of a different lens on evaluation. We're talking about accountability to our values. And so if we are not writing that in, if we are not funding that, if we are not changing our administrative structures to support that and to truly incentivize the implementation or operationalization of our system of care values, they are often going to be, our values are going to be hollow. And so we really challenge you to think about when you're developing your finance plan that you do not leave this piece out. So just some examples quickly around this. And there are, as I mentioned in the guidance document, there's a number of resources that will dive a little deeper into this topic, or you're welcome to submit a individualized TA request to dive into this a little deeper. But some things are just looking at, and like we've mentioned before, kind of implementing performance or outcomes-based contracts with providers, care managers, et cetera. Essentially your provider network as a funder, as system funders, how are you holding your providers accountable to living into these values of, cultural competence, youth-driven, family-driven? Include financial incentives in your contracts, here's another thing to think about is actual sanctions based on the certain established quality of care indicators or specified outcomes at the system, program, and family and youth and young adult levels. So sometimes, there might not actually be a consequence for not meeting the terms of your contract. So as a provider, you essentially may kind of slide by with not meeting those outcomes. And so what are funders doing to help with that, to help support, like with the network expansion and capacity building? So you want that support there, but also kind of so that's the carrot, but what's the stick, so to speak? So where are the consequences of, not meeting the terms of your behavioral health disparity statement, for example, that you might be writing. And another example is identifying metrics to track health disparities and disproportionality within child serving systems. I know many communities are working towards this on different levels, but how are you incentivizing these activities? How are you incentivizing efforts to address health equity at the provider, agency, and system level? So this is not just about providers, it's not just about system funders, and it's not just about families and young people or organizations. This is about at every level, what are we doing to hold ourselves accountable? So I'm going to pause there for time's sake and pass it to Dr. Freeman Foster.
Thank you. I think you covered this very well. A lot of times we look at the incentives, and sometimes the incentives are not enough to create equity. We have to really look at those sanctions. And I think when we think of sanctions, we think of taking money away or resources, or that people will suffer because of it. And they will not, because there are ways to create a sanction where you say, okay, if your goal was to serve this population and serve this many individuals this month, and you only serve this many, you get a percent of what you would have gotten paid, but there's an opportunity to make it up. So you don't lose the money forever, but you just don't get it this month. And so you hold people accountable to serving more than just a certain number of individuals, but serving diverse communities. How are you serving these individuals, and what are they saying about the services they are receiving? That's the other part of it. And a lot of times that creates an opportunity for conversation, because no one wants to not get their full check. And so now we have a conversation to go back to the drawing board and say, these are the disparities that continue to occur. How can we fix this? And it may be bringing on another community partner who has access and who has built that trust and who has built that bank with those individuals from the community, but at least there's a conversation. Otherwise, it continues to perpetuate inequities, and it continues to go on because there are no consequences for it. And so this is really important, that accountability, and that looking at your SPARS data, that's important. Who's missing, who's there, who's coming and leaving early? All of those are questions that need to be asked.
It just makes me think, if we do what we've always done, we'll get what we've always got. And we know that we have a lot of disproportionality in our child serving systems. We know that. And it varies, the degree of that disproportionality varies from community to community. And yet it persists. So I think the common denominator is the way that our systems are built, the way that our organizations are functioning. And so we encourage you all to think about, is it enough? Is it good enough? Is it, and I think, kind of going back full circle to the youth and family partnership, they can help you answer those questions. If we just listen, if we just set up those structures to listen, a lot of this work can kind of write itself, and eventually, not be needed. Although, we'll be on this journey for a while. So I know we're getting very close to time. So I think I just want to leave you all. We have one more question for you in just a second, but want to just let you all know yet again, I kind of opened up the session this afternoon saying this, but remember, you are not alone in this work. We are here to support you. You have many peers across the country who are doing exciting things. We heard a couple of innovative things like from Colorado, for example. And so please do call on us as you are needed, and know that, again, this is an iterative process, and the release of this publication today is not the end of this work. But only the beginning. So I would love to kind of close out our conversations today to think about future direction. So I mentioned that this is iterative. This is just the beginning. So I would love to hear, what additional training or technical assistance resources would you like to receive around this topic? There will be a feedback form, a session evaluation sent out to you, and all of these are being posted in the chat now. And as, of course, you have the opportunity to request individual or intensive technical assistance from INTAC, and we welcome those requests and process those pretty quickly. So please do let us know. So I'm going to see if we can just in the last 2 minutes together get this Menti up for folks. I'll go ahead and stop share. I think, Amy, did you have the Menti poll?
I do, Suki, but there's not any responses yet.
Oh, okay. No worries.
But we could open it up if anyone wants to just
Yeah.
ask questions directly.
That'd be great. We've got just a couple of minutes left for anybody who has any questions or reflections. It doesn't have to be a question, but
I will just add in the silence, just remembering the humanity behind all of this, remembering the humanity behind the money, remember the humanity behind the disparity, remembering the humanity behind the contracts and the data. Those are people who are being served well or not being served well or not being served at all, and they're suffering and they're hurting and they're dying needlessly. And so we have a responsibility. And the person and the organization or the system that's unreachable, there are people behind that we can reach. And so just keeping that in mind.
Mm-hmm. Thank you. I know sometimes we get kind of caught up with the data and just looking at it. Yeah, it's so important to just think about the humanity. As I mentioned, our systems and our organizations are made up with people. So how are we thinking about, wellness of our staff and our employees in the same way we're thinking about wellness of the people that we're serving? Yes, yeah. Thank you for the folks who participated in the Menti. It's yeah, I appreciate that. So we'll definitely take that feedback back. Well, I want to be respectful of everybody's time, and here in Nashville, Tennessee, it is 2:30 Central, which is our time's up. So thank you so much for your participation in these conversations. Thank you for listening. Thank you for the work that you do. Thank you for even thinking about how to finance your systems. That's really big and complicated. And as we said at the beginning, it can be very challenging, very confusing. So we are here to try to help you sort that out. These resources are available now on our website, and we will send the evaluation form out to you, as well as the PowerPoint slides and the, of course, links to the resources. So thank you all so much. I hope you have a wonderful rest of the week. And thank you so much for Jim and Pat and Dr. Freeman Foster for joining in this conversation, and really excited for what the future holds.